Well, let's get into this conversation now. Of course, one of our top stories that we are tracking for you this afternoon, another incident of theft has been reported at Chris Hani Baragwanath Hospital in Soweto. It caused disruptions to the water supply and affected the cooling system. Now, to discuss more this and other issues that are affecting the health system in the province, we're now joined by Gauteng Health MEC for Health, Nomantu, Nkomo-Ralehoko. Thank you so much for your time, MEC. So let's unpack then, some of the issues that we are currently seeing at Chris Hani Baragwanath Hospital in particular. I mean, we essentially are saying that in as many couple of days, this is the second incident to hit the hospital. Unpack us, take us through then, what are some of those issues that are hitting the hospital at the moment, particularly the one incident where we're hearing of the two breaches, that this posed a serious risk, to patients in the hospital's ICU. We now understand through some reports and, of course, interviews that we've held here that the theft of that 10-meter of copper wiring cable from a secured room at the hospital. And of course, this is housing pipes that are supplying oxygen to sections of the main ICU, was possibly an inside job. What can you tell us about these two incidences? And particularly, are they indeed inside jobs?
You are correct, my dear, because we were all shocked on Monday morning when we realized that now the clinicians at the facility noticed that there is a flow or the very low flow of oxygen, which is lower than normal because they know what type of speed is expected in the facility if they need oxygen. They reported the matter to the Department of Health and the Department of Infrastructure. And the Department of Infrastructure is responsible, if you remember, for the planned room where the escape was stolen. And this has led to the discovery that the oxygen supply pipe was tampered with immediately after they indicated that they had to check. The copper pipe was replaced and the process to move patients to the main intensive care unit was completed successfully so on Wednesday. So all those things were happened, but immediately we had to act swiftly so and ensure that all the patients are safe, they are secured, they're in another place, which is very good that at least we have a business now plan. If there is an incident, we call it business continuity plan, so that if there's any incident in any hospital, I always say, let's have a backup so that even if we're sorting out the problem or waiting for the DID, if it's DID that must do that, on our side, things are done. Then on Wednesday now, which was the 21st of December, in the morning again, nurses at theater 15 and 16 noticed water suddenly slipping from the system, which is called the autoclave system. Then immediately in that system, again, the equipment that is there is for sterilization of the machines in the theater. And again, when the matter was investigated, we realized that and we discovered that the copper pipes again from that plant were tampered with. So that was the second incident now that we said, no, this is uncalled for. It can't be 2 days in a row that both of the important areas in our hospital are not operating. And the damaged copper pipe now, in fact, yesterday, it was replaced already. This morning, acting HOD, the team from the National Department of Health, they went there because they wanted to see what's happening. So all those things, we sorted them out. And then we did it internally with the Department of DID because there are engineers from the DID that are residing in the hospital, that when there are incidents like these ones, they must jump in and help us. And both of these incidents that we're talking about have been reported to the police. We have case numbers because I said, let's open up cases. Police must start investigating this process. But we can't be bogged down by that. We must continue the work of the institution. And again, there was a water leak I'm sure you have seen this video that is moving around with a water leak now. A contractor has been on site since morning, and we have repaired those areas. In fact, even yesterday evening, when we got there, we immediately tried to do some measures of rescuing the patients so that they don't get affected. And after we assess that work that has been done, and now the repairs has been done, as I'm indicating to you. And the contractor again has been on site, and all the areas that were flooded, because out of that water that you've seen in that video, so many areas were flooded. And part of those areas, Ward 38, which was heavily flooded, Ward 22, Sakiti Phase 2 Center, if you know that we have that center at the back for oncology called Zakiti. Zebra Ward was affected. Outside JD Alan and POC lab, because we have those labs, even two, because they are closer to the area, they were affected. The ICU tier room was affected too, which is a critical room. Emergency was affected. Recovery room, because we have those recovery rooms, we have theater 15 and 26, including theater 1 and 2, they were affected. It seems that there is a deliberate attempt to disrupt the good work that we've been doing and that the clinicians have been doing in that facility, because I'm sure recently we have visited our facilities. Those who have not, I always say, go and see our facilities recently. We're trying to change them. We want to move away from this myth that the Department of Health is messy, because we are making sure that all the things that people always think that we can't do, we are capable of doing. We are doing them, and the patients are doing that work.
MEC, let me squeeze this question in, because your link is unstable at the moment. But I want to squeeze this question in. You're talking about, just some of these problems that you are encountering. In fact, in one hospital, but we know the picture actually looks dire across the province. We know that you are dealing with a crippling public health care system. And I mean, these issues that you are raising now are probably a symptom of that. Just going into some of the criminal elements that you're talking about, we know that, through, in fact, the Department of Infrastructure, as you've mentioned, there are several cases that they are looking at, not only in Baragwanath Hospital, but these also include Charlotte Maxeke Hospital, 2 cases involving 5 government officials in cable theft as well as the George Mukaru Hospital, 1 case there involving 3 government officials. So then the question probably is, in this business continuity plan that you are talking about, how does it also cater for, let's say, maintenance and security measures that you are taking, not only for hospital staff, but also for the patients?
You are right. This plan is catering for our hospitals, for the safety of our patients, for us acting immediately if there's anything that pick up that is correct in the institutions. For example, one of the area short-term interventions that we've done, already 17 of our hospitals have already been exempted from load shedding out of 37 facilities. That's another plan that we are doing. But besides, we have backup plans now in every institution. And our hospitals have generators now as a backup plan, which I believe that it's something that is a part of our business plan. And it's something that has been happening. You remember, sometimes we'll tell you that we can't do the operations because there is load shedding. Now there is nothing that says if there is load shedding, there's nothing that we can do. Now we have regular maintenance of generators in the facilities. That's why we have officials now that are stationed in the facilities that must make sure that if there's something that is happening immediately, there must be an urgent intervention out of those regular maintenance of our generators in the facilities, and we're prioritizing that. And again, we're ensuring that security of supply of diesel in specific cases. You remember, I'm sure in the last 2 months, you knew that we'll have a problem and they'll say, we don't have diesel. So we have that now. We are, once you say there is no diesel, we jump immediately and ensure that diesel is there. But again, I'm saying to the team, let's not plan poorly. Because for me, when you wait until something is completed, if it's diesel or anything, then that's the only time you report it. That's not how it's supposed to be. Report it immediately to the CEO and the team that is working in the hospitals, because their role is to ensure that there is nothing that goes wrong in the hospital. We can't have a hospital that can operate because the machines are not working whilst we are there maintaining and taking care of those hospitals. So I think we're trying our level best in working very closely. And again, we're beefing up. We're in the first phase now of rooftop solar PVA project that I announced it when I was still the MEC for finance. That project now is kicking off so that it can help us, including in terms of even solar energy in our hospitals. But the National Department, again, also announced that it's also considering phased approach of investment in renewable energy through solar power installation in our health facilities. Last week, we had the MINMEC, and again, Minister was emphasizing on the assistance of our hospitals, especially in Gauteng, where we have a lot of work that are coming to hospitals and that need to be rescued.
And I mean, one of the most critical questions then is, when will this all be finalized? I mean, I'm sure you know that nurses and doctors have gone on public platforms just talking about the conditions in some of these hospitals. We're now heading to the festive season. How confident are you, MEC, that in the state of all your hospitals in Gauteng, that you will be able to then deal with additional cases, particularly if you look at trauma cases, just going into the festive season? Maternity wards, we know at this time of year, are also inundated, etc. Some of the plans that you've just mentioned now sound to me as though they are medium to long-term plans. What are some of the plans that you have now for the festive season, given just some of the difficulties that you are currently experiencing now?
Already we have people that are on standby. It's one of our state of readiness, preparing for December. We had a session with the team, and we have agreed that out of this contingency plan, each hospital will ensure that they have core service. In the core services, we have sufficiently covered all the things that we need to do. And the plan outlines the health personnel that will be on duty daily, and the leave plans are clear, because I've said where there are those that will not be around, let's map up a way forward and a plan so that we don't struggle on that. The third one is that there are people that are on standby, as I've said, that will even be that will even do a recall on the additional staff when we are struggling. We don't have enough one. On the consumables, we have made sure that we pre-ordered and ensure that there's availability of our medical consumables. And our medical depot is working. The team there is not going to go on holiday. They will be doing some changes. Those that go will have another ones that are enough to assist us. Emergency and trauma departments they are well staffed now as I speak to you. Even this morning, Acting HOT had a team of preparing for rolling out these plans that we have agreed that we are going to work very closely. Not all people that come to emergency area are of high. All people that will come now to emergency area will be of high priority, because I have said, let's clear our emergency areas. And I think we've been doing that so well, working with the Gauteng Emergency Medical Services, because they are ready to beef up the team where we need additional teams, additional staff. And in the ICU again, ambulances were handed to the districts to accommodate those beds that will happen, transporting patients, because I'm sure you have seen our ambulances now. It's easy for you, even if you're in the ambulance, they can stop and you can deliver there. So we've strengthened that team with qualified people who know what to do when you are in the ambulance. And the other one, we've procured equipment for water rescue. As the weather, you can see that is unpredictable. So that is done already again. And we're deploying the drone technology to locate in the areas where it's hard to access, especially in the informal settlement. So we're working very closely with the team from the TID and the community safety to deploy those drones. And additional operation again that we have of that 110 staff members that have been deployed across the province. It's part of what you want to know. How many? So at least now I'm sure to you that 110 will be there. I will be there myself doing the monitoring in the team that is working in my office to ensure that everything runs smooth.
MEC,
Again, as the
I think
department,
we
we're
can
going to
leave it.
participate.
I think we can leave it there for now. You are assuring us, as well as our viewers, of course, that you do have plans in place this festive season and are very confident then that the teams are on standby and will be able to handle any eventuality. Let's leave it there for now, MEC. Appreciate your time. Gauteng Health MEC for Health there, Nomantu, Nkomo-Ralehoko, of course, talking to us then about those two breaches in security at Chris Hani Baragwanath Hospital and just some of the contingency plans that the health department has in Gauteng province ahead of the festive season.